I had a bridge on the lower part of my mouth, which had two anchor teeth, and there were a couple of, fake teeth in between. And the back tooth became infected. And because it had a root canal, I wasn't really aware of, it wasn't painful, but I noticed that there were changes, that my gums were bleeding. And so I went to my dentist and he said, this is something I don't want to touch. He said, you really need to go to a periodontist. Maybe he can just clean it out and you'll be fine. When I came in, that's exactly what the first thing he did. He said, this needs to be cleaned out. And he cleaned it out, and immediately I felt better. The tooth wasn't as sensitive. And that's when he said to me, I can send you home and you'll be good for a while. He said, but you may be coming back in the future if you have any problems with it. And so I said, okay. In the meantime, I said to him before I left, I said, if I do need additional work, I said, what could I expect? And he went into great detail. That's when the options came in. I asked him about the implants, because this really would give me the kind of natural teeth that I was missing. And we opted to go for that. And from that point on, he took great care to prepare me for every single one of the procedures. And he told me that if at any point that it becomes uncomfortable, just stop. He told me that he's very patient-centered. If the patient is comfortable, he continues. If the patient shows any anxiety, he steps back. He makes sure that we're okay. He'll ask if I need a break. He'll ask if I need extra time. Everything is to make the patient as comfortable as possible during the procedure.